Hello everybody, this is Sam over at the Foot Whisperer Reflexology Institute here today with our final hand reflexology video. This is the last part of the routine. We're actually going to be walking the most popular section of the routine, the part of the routine that everybody thinks hand reflexology is all about, which is the palmar surface. But there are a couple nuances that I need to inform you about because the thenar eminence can be a little bit tricky, and we also need to address the hypothenar eminence as well. So let's talk about the technique itself. Okay, everybody, so let's talk about how to walk the palmar surface of the hand. So when I say palmar surface, what I mean is that we are going to be addressing everything below the shoulder line guideline and basically above the pelvic guideline. So we're not going to be going into the wrist. Instead, we're only going to be addressing proximal head of the fifth metacarpal. There you go. From the shoulder line guideline to the waistline guideline, and from the waistline guideline to that pelvic guideline. Oh, and we have the diaphragm guideline as well. Boop, boop, boop. So we are only going to be walking in the palmar surface space. We're not going to be going above the wrist, and we're not going to be getting into the fingers. So let's get into how this routine is going to walk. First and foremost, we need to address the thenar eminence. This is the strong paddy muscle right through here that controls the tension within the thumb. A lot of people think that the thumb joint itself is where the pain or dysfunction or tension is. It's not. It's in this muscle here. So we need to walk this area thoroughly. But I warn you, please be careful because it is very, very sensitive, especially if you have somebody coming in with any kind of arthritis. There are diseases of this joint where it gets very, very inflamed, very, very contracted as well. So really be careful with this routine. But basically what we're going to be doing is we're going to be dividing the thenar area into its three separate sections, starting at that pelvic line guideline, all the way to that interphalangeal joint. Then we're going to go into the meat and then underneath, which kind of curves. So the thenar eminence, this muscle, we can divide into these three vertical columns, and we're going to walk each of those 3 times each. Okay, so on that more what would be the medial surface anatomically, then we have the middle section, and then that more lateral surface. And those are our 3 sections of the thenar. We want to make sure that we hit each of these 3 times to really be thorough. Then we're going to walk in line with each of the palmar tendons. And this is where it gets really fun because you have a guideline in the form of that ropey tendon to really guide your work. So we're going to start at the pelvic guideline, and we're going to, in line with the second digit, walk up that entire flexor tendon of the hand 3 times. Then we're going to go to the 3rd finger, 4th finger, and 5th finger, all 3 times. And this is really what gets you into those core digestive reflexes, a lot of the urinary reflexes, and through that right in through here, as well as at the end of those tendons, we're going to hit the hypothenar. This area we're going to walk 3 times as well. So we have 3 sections for the thenar, and then 5 different vertical sections, including the hypothenar. This hand diagram doesn't really have a big meaty hypothenar, but it's basically this area right here, this really paddy, squishy area. We want to address that as well and not just walk the tendons. So that is our routine. Let's give you 2 different camera views as far as how to walk that, and let's get to it. First and foremost, we want to gloss the palmar surface with a little bit of cream. Then we will address the thenar eminence, starting in that first row, thumb walk 3 times. We are literally on that first metacarpal bone. Then shifting to the meat of the thenar. This is the most muscular section of this 3-section area. 3 times again. And then slightly curling inward and hitting that third vertical column in the thenar eminence. Now we'll switch hands and walk vertically in line with each finger 3 times, all the way from the start of the pelvic guideline to the shoulder line guideline. Not going deep into the wrist or up into the fingers, just really sticking to that broad palmar surface. Last but not least, we will begin moving to that hypothenar area, that spongy padding of tissue that's on the opposite end of the palmar surface, 3 times. Perfect. Let's check out that entire routine from the other side. Again, start with a nice gloss of cream. Sometimes hands don't need it, but you never know. Addressing thenar first in our first column 3 times. Moving to the second column of the thenar eminence. And then the third column of the thenar eminence. Again, here you'll see, especially in this side of the routine, that I'm kind of curling in as I'm walking. A little bit of a dynamic surface. Now switch hands, and we're going to thumb walk all the way from the pelvic guideline all the way up to the shoulder line guideline, in line with each finger 3 times, just like we did on the other side. Really taking your time here. There are a couple dips to be aware of, but you are feeling for that really strong flexor tendon of the fingers to guide you in line with each finger. And last but not least, we are moving to the hypothenar surface as that last area to walk. And this completes our entire palmar surface of the hand routine. After this, we would go back to the dorsal aspect and then finish with relaxation techniques and hot towels. Great job, everybody.